When is therapist self-disclosure appropriate? Therapist self-disclosure can be a powerful tool in therapy, but it must be used thoughtfully. It is appropriate when it serves a clear purpose that benefits the client's therapeutic journey. This means the therapist should share personal information only when it directly supports the client's needs and goals. The focus should always be on the client, not the therapist's personal desires. Timing is crucial. Self-disclosure is generally more suitable in the later stages of therapy. By this time, a strong therapeutic alliance has often been established. Early disclosures, especially with clients who have trauma histories or boundary issues, can be harmful. They may lead to confusion or even re-traumatization. The client's diagnosis and context are also important. For clients with post-traumatic stress disorder or other trauma-related issues, therapists must approach self-disclosure with extra caution. Understanding the client's cultural background and emotional state is essential. This helps ensure that any shared information is relevant and supportive. Maintaining professional boundaries is vital. Disclosures should not shift the focus away from the client or create dependency. The therapist must always be mindful of how their disclosure impacts the therapeutic relationship and the client's progress. It is also important for therapists to engage in ongoing self-reflection and supervision. This helps them evaluate the appropriateness of their disclosures and ensures adherence to ethical principles like doing good and avoiding harm. Practical examples of appropriate self-disclosure include sharing a brief personal experience that normalizes a client's feelings or demonstrating empathy through relatable human experiences. These disclosures should be concise and immediately followed by a return to the client's experience to keep the therapeutic frame intact. In trauma treatment, such as for post-traumatic stress disorder, self-disclosure can help build trust and deepen the connection. However, it must be balanced carefully to avoid overwhelming the client. Minimal and well-considered disclosures can create pathways for deeper intimacy and healing in both individual and group therapy sessions. Overall, therapist self-disclosure is a nuanced practice. When used with clinical judgment and ethical mindfulness, it can enhance therapy. However, it requires careful balancing to protect client welfare and maintain professional integrity. Always remember, if you have questions about therapy practices, it is best to consult a qualified healthcare professional.